So Don, thank you so much for coming in and doing this little brief video for us. And I I thought of you when I was looking for a patient that's been a patient of mine for a long time and has gone through a lot of dentistry with me personally, some including some implants, not which I placed, but that I restored. And I did some bridge work on you many years ago. So first of all, tell me about what recently happened and what caused you to lose your bridge up on the top left.
Well, obviously I had a tooth that was supporting a bridge and it became decayed. And through your counsel, I obviously needed more biting area to take better use of my bottom teeth and to maintain some integrity in my bite. So it was kind of a no-brainer for me.
Yeah.
It was just a decision that had to be made if I was going to maintain my oral hygiene and just the integrity and whatever dental work I needed to be done.
Which is very important, and I might add, and I hope you're okay with this, and that, so thank you for your service to our country. You're a veteran, and you've dealt with some issues from some trauma in the past, and a lot of your problems you take out on your teeth. You have a very hard, strong bite. You grind your teeth, and we've worked with that over the years. And so it didn't surprise me that your bridge failed, because it's common for a bridge to fail on patients that have a very strong bite. And so I felt like when I counseled you on what to do for this tooth that you lost, I felt like a dental implant was the best thing that we could offer you. Now, you had some dental implants done a while back that I didn't do, so I found it interesting when I did your implant to replace this tooth. You're like, Dr. Mann, why didn't you do the other one? So tell me what was in your mind that made you ask me why I couldn't do the one before.
Well, because I wasn't happy with the implants I had done outside your office. I still deal with some discomfort a little bit because of them. And I always wanted you to do mostly all the work I needed in-house because of our relationship and because there isn't anybody that knows me better than you. Right. Nobody knows my mouth better than you other than me.
Right.
And I think you probably know it better than I do.
No, that's interesting.
That's fair. Having said that, I definitely, even when I had to have the other implants done, I had spoken to you about you doing them, and at that time you weren't doing them, and there was some disappointment, obviously, because I would have preferred you doing it. So when you took on the responsibility of doing my last implant, I was not only very pleased with that, but my outcome has been so positive.
Yeah.
I don't feel it there. I just, it's like everything else. It's been our experience right along. There's a continuity. There's a continuity to my just feeling better and not dealing with some of the issues that I have in the past that were out of the office.
Yeah.
So I guess ultimately I obviously trust you probably more than anybody.
Well, thank you for that. You know, we get that question asked a lot, like, can't you do everything? And I made the decision to start doing dental implants about 3 years ago based on the fact that I was getting asked from my patients like you so often, can't you just do everything here? And so it's not an uncommon thing for a relationship to be built between a dentist and a patient, and the patient will want the dentist to take care of everything. You know, we can't do everything, but at the same time, I felt like I could do a better job, and I do know your mouth, the best, and so thank you for the trust that you've given me.
You're welcome.
And I also might add that what's interesting to me is you recently, well, not recently, but you moved away from Manchester, and you drive a long ways to continue to see me. Tell me about that.
Well, like I say, our relationship goes back probably well over 20 years. And I lived locally up until about 7-8 years ago. We resettled in Plymouth, New Hampshire, which is probably a 55-mile one-way run from here. But there was no way that neither me or my wife were going to leave your practice. We'd drive it every time we have to. It makes no difference. It's something that is part of who we are, and we relish our relationship with you and the service you've always done to us. So
Thank you.
it's absolutely no problem at all. It's been a great experience for us as well.
Thank you. And one final question, and I like to really shoot straight with this, because one of the questions that we get asked from a lot of people that are interested in having dental implants is the cost of the thing. How do you justify the cost? Dental implants are expensive. You know that. I know that. So tell me, when I gave you the price and the fee to do this dental implant, tell me what went through your mind and how you ultimately made the decision. Yeah, I see the value in that, and I want to spend the money on that. So what process did you go through to make that financial decision?
Well, as you alluded to earlier, I suffer from pretty severe bruxism. So I've always had challenges in my mouth because my stressor is my mouth. You've always worked on getting me to a point to where I could be as comfortable as I could possibly be. So the cost of it was always related to our being able to work with you and the different plans that you offer. And it's always a no-brainer. It's just something you have to. We felt that strong about it. Both me and my wife, by the way. She hasn't had implants, but you've done an awful lot of work on Diane as well. And it's important to us. So we find through whatever plans that you're offering and financial assistance, we work it through, and it's in our best interest to always do the best we can to maintain the integrity of our.
Yeah. So the value is, you feel like the value is worth the cost?
Absolutely. Absolutely.
All right.
Yeah.
Well, Don, thanks for sharing your story with us.
You're welcome,
Okay?
Dr. Mann.
Very good. Very good.
Pleasure.